I'm also have a 50 years of experience in hair care business and in trichology. I'm practicing in Istanbul. I'm the co-owner of the Academy Hair Center in Istanbul, also the member of European Hair Research Society. I'm glad to talk about hair recovery program today because we have the chance to see positive results with the range of their products. It's a product range topically applied and a cosmetic-based treatment produced by Pharma Harvesi in Spain. And I would like to just introduce you some of their treatments with regards to promoting hair growth and prevent hair loss. It's a cosmetic-based formulation applied topically, and it's a very easy use treatment. It has certain types of formulations in terms of ampoules and phials. It's both suitable for clinic use and home use. It can be massaged into the hair, but you can also boost the effective results with the applying microdermal therapy or a laser treatment. It's a once-a-week treatment, so we can easily apply the treatment in a 10 weeks trial treatment. So it also have a lotion-based treatment that you can boost the effect of applications with a daily-based treatment, and it also has a shampoo-based treatment that you can just improve your hair quality with a daily use shampoo. So I'm a trichologist, and as a trichologist, we have some very strict ethical codes and a very ethical point of views. So when we start to treat our patients, we basically select some certain criteria. We do take patients and give them some reasonable expectations when recovery is a reasonable result for the patients. We can have some recovery when hair loss is temporary, like in telogen effluvium, like in chronic telogen effluvium, also like in traumatic hair loss. Also, we can definitely delay the onset of androgenetic alopecia. You can just start with the early age, or is a patient is a mature age, you can still delay and postpone the effect of androgenetic alopecia. And our main aim is also to treat the scalp. We have to bring the scalp into an optimal condition to get effective results from the treatment applications. So we have to take as a comprehensive treatment to change the hair quality. And definitely at the end, not every patient is a hair loss patient. They come over us to have the expectation that they want to improve their hair quality, they want to thicken their hair quality, and also they have a better hair condition at the end of the treatments. Hair recovery program is having a main ingredient as the oligopeptide that consists of 55 amino acids. It's actually an arranged formula from including basic plant-based extracts plus vitamins and minerals that all combined technology actually boost the hair growth. In the focus of increasing telomerase activity, it aims to lengthen the lifespan of a dermapapilla cell so that they can grow a better quality hair with the more interaction of the stem cells. It can enhance the growth of new hair. It does it because we know that sometimes the hair metabolism slows down. So you have to boost the hair when it's delayed in the form of growing new hair. So it also aims to activate dormant follicles. Again, we know that sometimes the hair production is delayed due to oxidative stress, due to scalp inflammation, due to by sometimes simple aging, or due to androgenetic alopecia. So it can sometimes activate the dormant follicles. It definitely repairs the weakened and brittle hair because as women, especially when we do so much cosmetic treatments, our hair condition deteriorates, and we have to get back to our stronger hair and better hair condition with the help of the treatments. And the treatment definitely, as I experienced in my own patients as well, thicken and strengthen each hair strands so that you can have a more volumized hair at the end of the treatment. When we look at androgenetic alopecia, most of my patients also comes with the same complaint of androgenetic alopecia. 90% of hair loss in men is caused by genetic predisposition. And the role of 5-alpha reductase and the testosterone is very well defined in many scientific publications. We know that testosterone is converted into dehydrated testosterone, which is a very potent androgen by the enzyme 5-alpha reductase, and it has a diminishing effect on the hair follicle size, and eventually the hair miniaturization gets into place, and the permanent baldness occurs. And also it has been identified as the main cause of the androgenetic alopecia, the DHD effect. But recent findings reveal that there is definitely an inflammation deterioration at the scalp level that we have to treat as well in terms of genetic hair loss. And so we believe that as a trichologist and as every expert in this field, we need a complementary approach to treat hair loss and to defend hair loss. Hair loss is a complete process that is triggered by stress, diet, ill health, obesity, and also environmental factors, scalp inflammation. So we have to find a complementary approach though, so that the patients can have an effective result, more satisfactory results. So when we combine these treatments, the basic ones are anti-DHD treatments, anti-inflammatory therapy treatments, low laser therapy, microdermal therapy of dermastams, the use of derma rollers and the derma pen as well. And also when the patient is a woman, we have to consider that there's multifactorial reasons that affect woman hair loss. So a medical intervention is a must, that we have to do the blood checkups, we have to do the hormone screen, and the doctor has to interfere with the patient in terms of supplying the patient with nutritional supplements. And also recently we're also mostly hearing about PRP injections administered by the medical professionals, sometimes help the patient to get quicker results, but we have to combine these treatments and select the best options for our patients. And also, we hear about binoxidil and 5-hydroxydactyl inhibitors, mostly in terms of inhibiting the hair loss in androgenetic alopecia patients. We know that they are the only FDA-approved medications to treat male pattern and female pattern hair loss. However, I have to emphasize that as a trichologist, I want to stay on the point that medical professions has to sometimes prescribe medicines, but I have to sometimes use cosmetic treatments, and people sometimes believe that or kind of influence that cosmetic treatments are not helpful enough to treat hair loss conditions, but actually hair recovery program and my other cosmetical formulations proves the opposite. And we have to always get into mind that there are some drawbacks to medical choices as well. Not every patient, say like a children, is not always the right candidate for medical preferences. And when we think of the lifetime dedication of these treatments, people has to use them for longer times, but sometimes patients are so much stressed, so much psychologically not proper and available to use a lifetime treatment. They quit the treatment and then they have a rebounding effect. They go back to their original state of hair loss, and they also get some kind of side effects that they don't enjoy the medical options. And also there are injectable methods or patients as well apply from time to time according to their problems and according to the problem severity, but painful injections and not able to continue with them for a long time also sometimes revert patients back to cosmetic applications. And when I talk of inflammation, it's a very important issue because the scalp health is the main component of the hair follicle, so that we have to maintain a very optimum health condition for the scalp. When we think of inflammation, it's not only a kind of scaling. There's many conditions like eczema, like psoriasis, like scalp sensitivity that combines with itching. So inflammation restricts hair growth. So it decreases the amount of oxygen and nutrients that supply to the hair follicles, so it can increase the androgenetic alopecia in a deteriorating way. It leads to tissue degradation. It speeds up the follicle miniaturization, and eventually the pattern hair loss, the androgenetic alopecia, speeds up, and the patient goes into more difficult conditions with, in terms of hair. So at scalp level, hair follicle cycle can be interrupted with the inflammation, especially the inflammatory cytokines, oxidative stress, telomere shortening, and the cellular senescence. In these conditions, hair recovery program speaks up for a very technological way to controlling and decreasing inflammation. It aims to activate antioxidant activity in the scalp level. It aims to remove free radicals that cause oxidative stress at the scalp level. It relaxes blood vessels so that blood can easily penetrate into the hair follicles, and also the inflammation can shorten the delayed growth of hair follicles. So my experience in terms of using hair recovery program, actually my special need is for a cosmetic-based topical solution is perfectly matched with the hair recovery promises, because from my point of experience, especially I take from my patient's experience, I succeeded to reduce scalp inflammation with the use of hair recovery program. It boosted the result, the effective result, the better quality of hair growth, and it's definitely stimulating hair production that I'm going to be sharing with you my before and after cases. And it's thickening the existing condition of the hair. It's giving a more shinier, more qualified, more proper hair condition for the patients at the end of the treatments. So I would like to give an example, a couple of examples of my patients who has experienced treatment in the time period of 18 months actually. This patient is a female patient who has definite pattern of female pattern alopecia, and she's 59 years old. She's in menopause definitely, and she has been experiencing hair loss for the last 15 years. But after the menopause, the hair loss deteriorated. The hair shedding increased, especially within the last 2 years, and that was the reason she came up to me and asked for help. She had very dry and brittle hair condition. She had to blow dry her hair to keep the hair in a proper condition. So with the administration of hair recovery program, we applied the treatments in a twice a week base for 2.5 milliliter of the half of the ampule for 20 weeks period time of treatment. And we also boosted the treatment with low laser therapy. And I also use a derma roller 0.5 millimeter to boost up the effect of the hair recovery treatment. And we can definitely see that she has a difference in the widening hair parting on the middle of the scalp. And she also improved in the hair quality that you can definitely see in the pictures before and after. And this is a younger age person with the definite pattern of male pattern hair loss. And he's been experiencing hair loss because he has genetic tendency. His father is bald, his uncle is bald. So we just want to delay the onset of androgenetic alopecia with this patient. He kind of also had an experience of different treatments, but he came up to me and asked if we can just strengthen the existing hair without promising new hair growth. I start to apply a hair recovery program, and his scalp was very oily, sensitive and itchy. So you definitely improve the hair condition that I'm going to be sharing his photos later in the presentation. We applied the treatment twice a week, and with the laser therapy administration. I don't want to use any microdermal therapy when scalp is very sensitive in terms of these patients. And you can see his hair thickening on the below, and also his hair pattern is getting a little bit more forward with the improvement. This is also another case. He also has a definite pattern, male pattern hair loss, androgenetic alopecia on the crown area and hair recession on the temporal sides. Actually, this patient again came to me saying that he always had the bald patch at the vertex area, but the hair loss is getting increased in terms of amount, and then he's been getting worse in the last 1 year. having some thyroid dysfunctions, and we reverted the patient to medical professionals to get the needed treatments. Also, we did the treatments of her recovery program for 16 weeks, and she was very happy with the result, because the increased shedding has got into a normal level, and she has definitely grown the delayed hair follicles to start to activate new hairs again, and she did a specific narrowing on the topical frontal area, and also she has grown hair from the frontal recession area, and also she had better hair quality. And this is a special case, actually. My patient is 50 years old, but when you look at her picture, you feel like she is more than 60 years old. The hair is very important in terms of people's appearance and also in their psychology. This was a COVID-19 positive patient. She was hospitalized in the month of March, and then she has been given so many powerful medications. And after she left the hospital, 2 months later, she started to have a very extreme increased amount of hair shedding, like 400 strands a day. And she was very panicked. Actually, she definitely had post-treatment medication is a type of telogen effluvium hair shedding, and she would have a definitely recovery after this condition, but we have to hasten her recovery and make her feel more relaxed and comfortable, because she was very stressed and we're not able to control this condition alone. And she has very positive results. She had very dry and brittle hair condition. Her hair condition also improved very well, and she's actually still our patient and going on to treatments for maintenance, and she's also very happy with the treatment results. So I want to emphasize that definitely cosmetic-based formulations can change the hair condition in a better way. It also, as I mentioned, can control the inflammation on the scalp. You can see from the blockage, the sebum blockage, sebum buildup. You can see the inflammation red dots on the scalp before the applications, and you see that after the application of at least 5 weeks of treatments, you can definitely clear up the scalp and improve the hair into optimum health scalp condition. And this is also another example of the scalp condition. Again, you can see that there is this keratinized cells, the cell buildup, that cell buildup over here, and the scalp is very sensitive and it gets easily oily. And after the treatment, the hair condition improves. Also, the scalp condition improves. It's always a combination of getting the scalp into optimum condition, and then the hair reacts accordingly. So this is the end of my presentation. Thank you for listening to me. I would like to thank Adrian for giving me the chance of speaking of my experience. And if you'd like to have ask questions, please contact Pharmahermetic, info@pharmahermetic.com. And you can also reach out to me. I will be happy to help you from info@academicssaçterapi.com. Thank you.
Dr. Bayraktar, thank you very much for your presentation. It was very interesting, very useful, and I'm sure that some of us will contact you. Thank you very much again.
Thank you. Thank you.